The following DVD presentation reinforces the key points of the exercises demonstrated on the course weekend exercise prescription for the injured person. The seated bench press, or chest press as it's often known, is quite a simple exercise if we fire away there, Miss Penrose. The patient is locked into the machine, so there's not a great deal that we can do wrong. The key factor is that the patient's low back is well supported. Just make sure that their bottom does not slip forward on the seat. The bottom must be back well supported into the seat. Cut. The prone pull. And away you go, Bridget. Now the key points with the prone pull, just making sure that once again the patient is not overreaching. So they're just going down to arm's length, and the elbows are kept close in by the side. I call it the marching girl. The elbow should swish the side, once again focusing on the rhomboid and low trap region, or certainly the lower rhomboid muscles, or the lower aspect of the rhomboid muscles. The legs can either be straight or bent, whichever is most comfortable for the patient. The prone fly. Take it away here, Bridget. Okay. Now, arms up and out. Okay. Let's lower that all the way down. Okay. And come up all the way up. Now, how much back extension is brought in is completely individual to the patient. That's your decision. You can keep the chest right down and simply make it a shoulder movement if you like. Or you can add a wee bit of back extension depending on what the patient is requiring. Other than that, Bridget's doing this quite nicely. We emphasise at this stage the abdominal bracing, making sure that with all of these exercises, as has been taught, you are teaching the patient how to brace the abdominals whilst you perform the exercise. And once again, the patient will really feel this through the rhomboid, low trap region, and also in the tricep region. Making sure that the neck, head and neck are in a neutral position, and keeping the arms low and well down to the side, not allowing them to come too far into the abducted position, as that brings in too much upper trapezius movement or action. The wide grip front pull down, and we make a note of the wide grip. Away we go there, Dev. Key factor is to thrust the chest, and what you say to patients is thrust your chest. By doing that, automatically you're squeezing the muscles in between the shoulder blades. Make sure that they really only come down to chest height, as Dev is doing here. A real trick that people will do is they will take the bar too low. Dev is demonstrating this well now. The leg press, what is crucial here is that the low back is well supported again and the patient drives out of their hip joint. This is absolutely crucial. The bottom must not slip forwards. The bottom must be tucked right back into the equipment. As the patient pushes out, and perhaps if you would push out and just stay straight there, Dev, do not hyperextend the knees. They must not allow the knees to hyperextend, only go out to just the straight position. And of course, middle of the kneecaps out over the second or third toes. I exaggerate over the third toe so that the patients don't actually come together. Keep going there, please, Dev. So good positioning, well supported, driving from the hip joint, knees in alignment. Standing hamstring curl, and if we take it away there, Dev. What's important here is that you'll note that Dev is leaning forwards. Now this stops the hip hitching that people do. Dev, if you would come back and demonstrate, if Dev comes up too straight, and he will demonstrate, now this is what people often do, they hip hitch, and it really causes problems across the low back. People must not do that. Go back to the correct position. To prevent people from doing that, just lean forward slightly, okay? Dev's perhaps over leaning now just to exaggerate, which is fine, and away we go. The other key factor here is note that Dev is lifting his knee away from the roller, okay? And this just brings a more normal action to the hamstring because of course the primary action is to flex the knee, the secondary action is to extend the hip. So it brings in a more complete demonstration of the exercise. The dumbbell bicep curl, leaning against the wall with the feet out from the wall a wee bit so that the back is well supported. So that if the back comes off the wall, the person immediately knows that they're doing a cheat, which is not allowed. Very important that the back is supported up against the wall. Other key points is we twist up and in, as you can see Miss Penrose doing here, aiming towards the throat, coming in towards the body. The tricep push down, key factors here, patients in a well supported position, well balanced, and when the elbows are tucked in, okay, push down please Miss Penrose, all the way down. Note that Miss Penrose is flexing the wrist at the end. It's important that they spin the bar so that the wrist is in a neutral position so that you're not straining the wrist. Can we keep going there Miss Penrose? Okay, that's it. Now that is correct now. The pec deck. Important feature here, not all equipment, particularly in commercial gyms, has the ability to be able to adjust the pads here. If that's not the case, advise your patients, and Dev is just going to demonstrate how to get into a pec deck without hurting their shoulders. Could you demonstrate please? He twists one side, brings it around, twists the other side, brings it around. Perform the pec deck, very simple exercise to do. Again, just making sure that the back is in a neutral, supported position, really quite straightforward. Now, once again, coming out of those machines that are overstretching, Dev, if you would release one arm and then release the other. Now, this is very important because a lot of the commercial equipment really can strain the shoulders. Perhaps if you just would like to demonstrate once again, and away you go. The key point to the seated row, note the vertical handle to the horizontal. Patient is in good straight position and really squeezing the shoulder blades. So we're working the rhomboid region. The incline prone fly, Bridget, if we could actually lie in this position. What's important here, note that Bridget is lying down, she is not sitting down. So she actually lies down prone and takes up the position. From that prone position, two arms up and out, note the lateral rotation, so thumbs up and out. Once again, really focusing on that middle back region. Because you're on that slight incline, it really comes into the low trap muscular region. Close grip pull down is a very simple exercise. We just make sure that the patient is in good position and we're pulling down to the throat using the close grip reverse handle. The front lunge. Take it away, Bridget. Key factor here is stepping out. As Bridget steps out, note, and let's go again, and just stay, that Bridget's tibia is fairly vertical and that the knee is certainly perpendicular with the heel. It may even be a little bit backward from the heel. If we would come up again, please, and step out again, please, Bridget. This time, actually, if you would just bring your leg, just drop down on that knee and bring your leg back a wee bit. What's important, just bring that back a little bit further, okay, and lean forwards. You'll often find patients will end up in this position. That must not happen. It just simply places too much drive through the knee. So the end position of the lunge should be much more in this type of position. And if we just stand up there and demonstrate that again, please, Bridget. That's it, and back. And away we go again. Now this is a dynamic lunge which adds more proprioception to the exercise. The other one, if you actually just come out into the lunge position, please, Bridget, and just staying there, okay, and just stand up. That's it, and down. The static lunge that Bridget is doing here does not challenge the proprioceptive system as much as the dynamic lunge. It is the practitioner's choice as to which you desire for that patient at that point in time. The butt kick. Away we go, Bridget. Key point here is toe up, knee up, toe down, knee down. Making sure that we don't go too far backward, okay? It really only comes back to just behind the person's heel. They don't end up way back, extended out. That's it. Leaning forward so that the back is well balanced there, well stabilised, well supported. And the important thing is that the movement is initiated by the buttock, so the patient consciously tenses or contracts the buttock throughout the movement. And it is toe up, toe down, knee down. Keeping the back nice and stable. Very good firing pattern exercise for the muscles for the low back, buttock and hamstring region. The bicep curl using a curl bar, and the reason for the curl bar is that it places the wrists in a more neutral position, so it's more comfortable for the wrist. Leaning against the wall, feet out from the wall, same as for the dumbbell bicep curl, so that the back is against the wall. So if the patient's back comes off the wall, immediately it's a cheat. Take it away, please, Dev. And all the way up. Make sure that the patient extends, lowers the arms right down, come up and just draw the arms forwards a wee bit also. Part of the action of bicep is to flex the shoulder, of course, and we're getting a complete action of the muscle once again. Quite straightforward. Dev is demonstrating an incorrect technique here where he's not extending the arms all the way down. This is a common fault with people. Dev, if you could extend your arms fully now, note the difference. Okay, so full extension, and now please go back to doing the cheat, where people really only use the mid-range of their muscle. This is a common fault. Look out for that and correct it. The elbow extension, or otherwise known as the tricep kickback, if we take this away, Bridget, that's it. Your key point here is that the upper arm must remain horizontal. It must not drop down. And this is a fault or a cheat trick that people allow. Of course, you're not lifting against gravity there and really not doing anything at all. So keep the upper arm horizontal. At the same time, it mustn't be too extended, as that can strain the shoulder. So dead horizontal is where we want it. Then a slight inward rotation really works the medial head of the triceps, makes quite a big difference if you just add that little bit of inward rotation as we perform the exercise. The patient is, keep going there Bridget, the patient's in a broad side stance, so the exercise is in alignment with the body. The incline dumbbell press, very straightforward, simple exercise. Once again, most important that the low back is well supported in a neutral position, leaning against the bench, and simply driving straight up over the nose. Can be a personal preference for people to come up and actually turn inwards. Let's just demonstrate that as Bridget demonstrates there. Makes no difference, whatever the person's shoulders feel is most comfortable. The inclined dumbbell press. One arm pull. Key factor here is that the foot is well out, okay, not in close, so that the patient is more balanced, so they've got a good stable base. Back is well supported, 3 points of support, the hand, the knee and the foot, okay. Then we laterally rotate and we twist out so that the weight actually hits into the patient's hip. It does not end up coming up here, overextending. This is a common fault that people will do, okay. Continue there please, Bridget. So just note that. Also, not overreaching all the way down. So just arm's length up into the hip and really aiming to try and draw the shoulder blade across the chest wall. So you're really working the middle back region, and indeed if we put a little bit of rotation into the trunk rotation, you'll get the rotatories and erector of the low back lumbar spine. Reverse pec deck, and if we take it away here, Dev, really speaks for itself. Once again, back is in neutral position. What you're saying to the patient is thrust the chest, squeeze those muscles. Very good exercise for the total back region through here, particularly the rhomboids. Fairly straightforward. Better if the pads are rounded, as it can sometimes dig into the backs of the arms, but you just have to deal with the equipment that you have. An important point with the reverse pec deck, make sure that the patient doesn't protract their chin. Dev's keeping his chin and neck in a nice neutral position. Sometimes patients will tend to protract. Make sure that they avoid this. The upright row, first of all the patient's grip or the person's grip on the bar, about thumbs apart as Dev is doing here, okay, and take it away Dev. Up underneath the chin, raising the elbows as high as you can, making sure that you're nice and stable. Very important with the upright row that there is no swing. Perhaps you would give us a swing, a hip swing, Dev. This must not happen. It'll injure the back and it is a common cheats trick. Must not happen. Must be in a nice stable position, well balanced on the floor, and Dev is demonstrating this well. The backward lunge, take it away please Bridget. Virtually identical to the front lunge, just making sure that once again, as Bridget goes back, the tibia is vertical. The only difference with this is that because we are initiating a backward movement, we tend to fire up the glutes and hamstrings more actively than when doing the front lunge. The inclined dumbbell curl, exactly the same action as the standing dumbbell curl. The difference here is that the shoulder is able to extend beyond the body limit, so therefore the muscle is working through a larger range of motion. So it's often a progression on the standing dumbbell curl. Other than that, the technique is exactly the same, supinating up and in, flexing the arms as the bicep is a weak shoulder flexor, making sure that the back is stabilized, well supported, fairly straightforward. Up and into the chin.